My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll.
Hello, Metalheads, and welcome to the jungle. Thank you for coming back for this edition of the Heavily Meddled Podcast. Today, I'm excited to have my friend, Dewayne Armstrong, on the podcast. We've seen him before in our question and answer episode with Melissa and Dr. Schroeder, but today you're going to get to hear a more personal look into his story. It's a pretty interesting one. He has spent more than a decade seriously ill without any answers before realizing that he had a systemic metal allergy to orthopedic hardware. And as we all know, that comes with a lot of disbelief from doctors, a lot of gaslighting, disbelief from relatives. He's had multiple surgeries, years of worsening symptoms, and ultimately he's experienced a lot of symptom resolution, pain relief, and all kinds of things when he had his cervical and lumbar hardware removed. It's been a kind of a long and interesting journey to even get to where he could have the hardware removed, and he's going to tell you all about it. Welcome on, Dewayne.
Thank you.
Dewayne is joining us from Virginia, and I'm excited to have experienced a lot of his journey with him. But before we get into that story, Dewayne, can you tell us about who you are, where you're from, and a little about your life before any injuries, who you were professionally, and what your personality was like, and how you would describe yourself physically and mentally back before you got sick?
Before all this happened, I was a carpenter. I was very energetic. I had lots of friends. I did all kinds of things. I just had a regular, normal life. And then when this hit, I guess around 2009, I was working at doing carpentry and I got bored of it. So I went searching for a different job. And I did 6 or 7 different jobs and finally landed at Alcoa. And I really liked it. I was packing siding at nighttime. And I liked it mostly because it was at nighttime because I'm just not a morning person.
We share that, right?
Yeah. And somebody had moved one of the carts that was behind me where I was packing siding and putting it on there. And we had earplugs in because it was so loud in there. I pulled the crane back with all the weight on it and it hit me in the chest because there was a bar behind me from the trailer that wasn't on the other one. And it hit me right in the back of the spine. And all that weight pushed me up on it. And that's what started my journey.
Okay, what kind of injuries did you sustain from that?
In the beginning, they kept telling me there was no injury at all. They couldn't find it. So that really messed me up with workman's comp and everything. After about a year, I finally found a doctor that tested my discs, and I had 3 torn discs. Really?
In your neck, or are we in your lumbar?
My back. My neck come about 5 years later.
Okay, we'll get to that in a minute. So tell us about the lumbar first.
So they just overlooked the problem for over a year. And finally, when I found it out, I had to go way off to get a doctor to even do anything. And after he did it, about a year, maybe 2 years later, I was having difficulties.
After he did what?
Fused my lower back.
Okay, how many levels did he fuse in your low back?
3.
Okay, 3 levels in your low back from L5S1 to L3?
Yeah, I believe that's right.
Okay, and that was with rods and screws and artificial discs, correct?
Rods and screws. I think that it was
cages
just
where the disc space was. You have to
yes.
put there. Okay.
Yeah, it was just all bone now.
Okay. And immediately after the surgery, did you recover?
Yeah, I recovered fine. For about the first 10 months, I was fine. I was just getting ready to go back to work, and it just hit me where I just didn't feel right no more. Couldn't figure it out. And then my neck had started jerking.
Okay, I know that you were having some dystonia in your neck, which is the jerking you're describing. You said you just started not feeling right. Tell me more about those symptoms. What did you notice?
That was over 20 years ago. I lost my energy. I just did not feel right. Something just did not feel right. The pain started getting worse, like worse than when I went in for the original surgery.
And was it body wide or was it localized to where your fusion was?
It was pretty localized. The body wide come later on.
Did you have any memory issues or anything at that point?
I did have a bad memory issue, but I was told it was from taking too much Tylenol. It's hard to know what really happened right there.
Okay, so you started having memory issues. Did you have any GI issues at that point or skin issues?
I had GI issues before that point, so it was hard to tell. They did get a little worse.
Okay.
If I didn't take a shower every single day and get the stuff off my face, it would turn into like sores.
What stuff on your face?
I don't know what to call it. It was like the skin would just kind of like bubble up.
So if you didn't keep your skin clean, like just sweat and bodily fluids and stuff like that?
It wasn't really even that. It was just like this would happen like almost overnight.
Okay.
I had to use Head and Shoulders. Any other brands didn't help. It would just keep getting worse. But Head and Shoulders had something in it that would take it off, and it would be fine if I just kept that routine.
You sweat in all these places, and we know we sweat out nickel and vanadium and other metals. Stuff's coming out through your pores.
That could possibly have been it. Yeah.
Yeah. Okay.
I had no idea what was going on at the time.
So let me go back for just a minute. So you said you were super active before your injury. Did you have any health issues at all before the spine issues started?
I had something called Weber-Rondi syndrome, but I was born with it. And they actually removed half like my right middle lobe of my lung when I was 7 years old.
Okay.
I had surgeries on that. They found out they could put balls and balloons in my lungs and make the oxygen go to my brain instead of circling around in my chest. And that basically saved my life when they removed my right middle lobe. That was pretty much taken care of by the time I was 21. I didn't have no more issues. And then this happened when I was 27. So it was a few years between the two.
So let's bounce back to your spinal injury. What were you told that would fix? And then did anybody discuss risks beyond infection with you or mechanical failure? Did they even bring up that metal allergy was a possibility at the beginning before your surgery?
I had no idea about metal allergies until about 6 years ago.
So no, do you know what metal that they implanted at the time they implanted it? What particular metals? Or you just knew that they were going to put in hardware?
I knew that they put in vanadium. It was titanium with vanadium alloy in my lower back. I know that.
At the time of
much.
surgery, you knew that?
Yes.
Okay.
Because I remember seeing on the paperwork.
And so you said it took you about a year to realize that something wasn't right. And you started first having symptoms. How did they progress? And then I know ultimately you had another surgery, fusion in your neck. So bridge the gap between the lumbar fusion surgery and the cervical fusion.
I started begging them to take the metal out. Just take it out.
In your back?
Yes, because I felt like it was causing problems. They told me there was no way that it could be doing anything. I was like, are you sure I'm not allergic to this stuff? They kept telling me, many doctors told me that there was no way I could be allergic to any of this stuff that they put in, that they test this on people, that they know that there's no way that I could be allergic to anything. And that's what they kept telling me. So that was like somewhere between a year and 2 years after that. Then the dystonia started in my neck.
For people that don't know what that is, that's like twitching in the neck, jerking and twitching.
Yes, and it got very bad. And then I started going to the doctor saying, I hear crunching in my neck. See, there was no injury to point to look for anything. But for 4 years, I battled them to take a look at my neck. And I was telling them I could hear the crunching. People sitting beside me could hear the crunching in my neck when I was moving it around. That's how bad it got. And they did all kinds of contrast, without contrast. They'd done x-rays, MRIs, CT scans, couldn't find nothing. Finally, I had a doctor. He picked up my case and said, I don't think anybody's going to keep coming to the emergency room this many times if they're just wanting pain medicine or something like that. He said, I think you've really got something going on. They finally ended up testing my discs. They said I had 2 torn discs. So they cut me open right here to go in for the 2 torn discs. That night, they sewed me up and put me in a halo because I had 3 crushed vertebrae and 3 torn discs. Well,
how did that happen? Do you know?
Don't know. The only thing I can think of is maybe I cracked one of the vertebrae at some point, and the dystonia just kept so much pressure, just crumbled.
And were the symptoms consistent, or did they flare?
They were consistent. This was like a nonstop thing for 4 years. Like I said, I could not get no help. They were just telling me, this is all in your head. I even went to Johns Hopkins. They sent me home with pills to make me out of it. And for 3 months, they worked, but I did not feel right at all. And I was like, no, there's something going on in my neck.
Were the symptoms only in your neck or your lumbar spine, or did they move throughout your body?
That with 3 crushed vertebrae, it's pretty hard to tell if it's anything else going on. That was pretty painful. Even when they got my neck done, as soon as they'd finished my neck, my back started hurting again. Like they never finished with my back before this started.
Did you ever feel like your body was attacking itself?
Yeah, the whole time. It's very hard to explain because it was just so much pain throughout my neck, my back, and it was just going back and forth. Once they fixed my neck, it didn't jerk around very much. And I automatically started feeling the pain in my back again. But then after it healed, the dystonia even got worse. So
we're going to talk about why that is in a minute. I think you know why that is, but for those who don't know why that is, we're going to talk about that. Can you tell me how many doctors you saw during those years, if you had to guess?
It would have to easily have been 40, easily 40.
And what diagnosis did they give you?
It was all different diagnoses. None of them had the same diagnosis. Most of them, it was just, it's in your head. This is just something that happens after surgery. It's not perfect with everybody.
So you're getting that it's anxiety, it's depression, psychosomatic, and you're exaggerating.
Yeah, pretty much. It was me at that point. It was just me.
How did it feel not to be believed by professionals?
That wasn't the worst part. It was not being believed because my family were like, we've heard what the doctors have said, and nothing's wrong with you. So they stopped believing anything I was saying.
So you're just seeking attention and you're being dramatic and you're losing credibility when before surgery you were just this normal guy, right?
Yeah.
Did you ever stop seeking care because of how you were treated? Did you ever just give up on it and think I'm just going to stay home and forget it?
I did give up for about 8 years at one point.
That's a long time.
After they shut the pain clinic down and the doctor retired, I didn't really have nowhere else to turn and nowhere else to go. So I just stayed home and suffered with it. In 2019, a doctor told me that he could help me with some of this, and he put the SI joint hardware in.
So that's a fusion to the SI joints. I have the same thing. So they put 3 rods right through that joint in your pelvis to stabilize your pelvis.
Yes, and that had vanadium in it as well.
I'm going to throw your x-rays up on the screen so people can see all the different places. Our spines look dramatically similar, right? Let me go back and ask you for a minute. In the middle of all of this, and you finally give up and you're sitting home and the doctors think you're crazy and your family thinks you're crazy, was there a moment that you began to doubt your own reality? Did you think you were crazy, maybe, potentially for a minute?
I wondered, but I was like, there's no way I'm not feeling this. There's just no way. Just because of the way it was moving back and forth. I did have aches and stuff all over my body, but that didn't stay there. I thought that might have been in my head, but the back pain and the neck pain I knew was coming from this.
How damaging do you think the medical gaslighting was to your recovery?
When I went looking on my own, if I wouldn't have found anything, I probably would have given up. That was that bad.
I think a lot of times we ignore the emotional depth and trauma to our relationships and things like that. How did it affect your relationships? Go into that for a minute. Did you have a girlfriend, your family, your mom and your dad and your siblings?
I had a fiance. She ended up leaving me because she thought that I was okay and that I was making this stuff up. Because when she met me, I wasn't like this, but she was there the whole time. It doesn't seem logical to me that she wouldn't believe me.
So So it cost you a potential marriage and a family.
Yeah.
And what about with your siblings and like with your mom and dad? How did it really impact those relationships? You said they didn't believe you.
It damaged it severely. The only person in my whole family that believed me at one time was my mom. And when she passed away, I was like, I can't just let all the time and effort she put in just go up in vain. So I started looking for myself. And that's when I come across the place in Chicago where they test you.
Orthopedic analysis.
Orthopedic analysis. Yes. That's when I come across that place. And they told me to get on Facebook and put my story out there and reach out for help. And that's when I met you. In 2019, when that doctor put the SI joint stuff in, it wasn't but maybe 6 months after that, I started losing weight like crazy. And for a year, I went from 185 pounds down to 123 pounds. And the doctor I had at the time was just telling me, oh, you're a healthy young man.
And you're not a short guy. So let's put that into perspective. How tall are you?
6 foot.
Okay. What's a healthy weight?
If you look it up, it says anything above 140. But I was at 185 before all this started.
Okay.
And I got all the way down to 123 pounds. And so I decided this guy's a quack. You don't know what he's talking about.
You lost that much weight because you couldn't eat, correct?
Yes. And I couldn't figure out why I wasn't eating. I thought it was a medication I was taking or something.
Was it nausea? Was it stomach pain? Was it diarrhea? Was it bloating?
It was burning. My
Okay.
stomach burned like crazy. Even if I drank water, my stomach would burn.
And you'd never had that before your
Never.
SI joint surgery.
Never felt anything quite like this. No.
So we've got a slow buildup of symptoms from the localized pain to the fatigue to the memory to now it's moved into the stomach burning. What about insomnia? Did that creep up? Did you have that? And when did that set in if you had it?
I don't know if I would call it insomnia, but I was a night owl beforehand anyways. But I had to start taking something to go to sleep because if not, I would be up for 3 days and then finally just pass out from exhaustion. And that went on for about a year before they ever found something that would help me.
So let's get into the diagnosis part. Where did you start to get a hint? You were asking your doctors early on if you might be allergic. When was the kind of aha moment? When did that come onto your radar? And then from beyond just a casual thought of, hey, could I be allergic to this? When were you like, hey, I think I'm allergic to this? When did that happen?
That happened like about a year or 2 years after I first had the back surgery. I was thinking that the whole time. They just kept telling me there's no way that could be a possibility.
So how did you find orthopedic analysis and then get tested? And was that after your SI joint fusion?
That was after my SI joint fusion.
How did you find them and decide to get tested?
I'd asked my phone all kinds of questions before. I think I asked, can burning in the stomach and a metal in your back cause you not to be able to eat? That's when metal allergies popped up. I was like, what? I was like, I never heard of a metal allergy. Nobody's ever told me about this because I was told that I couldn't be allergic. So I started reading and reading. Finally, I found the orthopedic analysis and I ordered the test. As soon as I seen it, I was like, I'm going to order it and I'll figure out a way to pay for it. I had just sent my blood in when I put my story on Facebook, the metal allergy post, and you've seen it. That's when you told me what you were taking to help you. And I figured I'm going to try that too. And it was the Allegra and the Pepsi. Within a week, I started eating, not a whole bunch, but I was eating more and the burning went out of my stomach. And I was like, this is it. That was my aha moment.
I'm trying to remember if we met on a Facebook group or did you message me privately? Do you remember?
I put my story out and you said something on there. And then you asked me if you could call me.
If I remember right, I think I probably saw your photo of your spine. And I was like, that's my spine. And I think our stories were just so similar that I sent you a private message and then we just started messaging. Does that sound right?
You sent me a private message and then you asked me if you could call me. And we talked for about an hour that night.
I remember that because you pretty much were ready to give up. You were borderline suicidal and you're like, I'm just done. I can't go anymore. And I'm like, oh, no, you're not.
Yeah, because even after I got the test back, I went to 20 surgeons around here within a 200-mile radius and even some farther. And they were still giving me these same stories.
Okay, let's talk about what your test showed. I'm going to throw your test results up here. Why don't you tell us what those test results showed?
Everything was normal except for the bone cement showed 4.8 and vanadium showed on the line.
Okay, so mild reactions to vanadium and bone cement that, depending on what doctor you show, they could be taken as negative, but there was reactivity there. Now, you didn't show at the time any reactivity to nickel, which is what most people react to, but because there was some reactivity, we're going with that you're allergic to vanadium.
Yeah, that's all I really knew I had in my body. I'm still not sure what I had in my neck. I do know it was different from the papers they give me, but
Most surgical titanium is Ti6Al4V. Most commercially pure titanium in orthopedic hardware is at least 4% vanadium. So we can probably just assume for right now that's what that was, and there was vanadium in that. Do you know if you had bone cement anywhere? And I think you also had an elbow injury that we didn't talk about. Can you go back and talk about that elbow injury for a minute?
yeah, I had a accident. Actually, I think it was in the same year, 2019, but it was just before the SI joints. They put that in my arm and it healed up fine and everything, and I could use it fine. About 6 to 8 months later, it just started throbbing so bad. I was like, either you take my arm off or I just can't live like this. I never felt a throb like that from anything. It was just nonstop, like day and night, couldn't sleep, couldn't do anything.
So what was the diagnosis on the elbow?
I know he used bone cement in it, but there was also a metal plate that he put in there that had vanadium in it. And I know I was allergic to it because as soon as I talked him into taking it out, the very next day, the throbbing was gone. Felt like a whole different arm. And within 3 weeks, he wrote me a letter dropping me as a patient.
Oh, no.
Yeah.
Why?
Because he did not want to take it out.
Even though all your symptoms resolved from that when he took it out.
He didn't even call me back in to see how it helped.
Oh, wow. And you never told him how it helped, so he doesn't know to this day?
Not that I know of. Right after surgery, I told him, wow, the throbbing's gone. That's it.
Do you know if he used any bone cement in the elbow?
I'm sure that's where it come from.
Could it still be in there, potentially?
It's a possibility, yes.
Do you have any pain in that elbow still?
No.
So we got the metal allergy test, we got the vanadium, then you start trying to talk to doctors about taking out your spinal hardware. And you talked to how many?
It was over 20.
You went to some big name clinics.
I went to Richmond. I went to Charlottesville, which Charlottesville's a pretty big place. In Richmond, that's where I had my neck surgery and my back surgery done. So I know they're pretty big places too. I had also talked to some doctors that were in other states, but they didn't accept my insurance. But then you told me about the doctor in Texas, and that's where I put most of my eggs because you already went through there. He already knew what was going on.
Yeah.
He already believed in it. And I was so amazed when he said that he would take it out of my back and neck at the same time. I was ecstatic.
I want to talk about diet for a minute. So you don't have a traditional nickel allergy. You said the Pepcid and Allegra was helping you to be able to eat. So that speaks to the fact that we've got an allergy going on. And I think you might have even started with the Pepcid and Allegra before you even had the orthopedic analysis test, right?
I started before I got it back, yes.
Right now, we don't have a nickel tie-in, but did you ever try a low nickel diet and did it help at all?
Yeah, I'm still basically using the low nickel diet. I know it helps.
Okay, so then there's got to be some kind of nickel sensitivity, even if there's not a type 4 allergy, right? And many people that are allergic to one metal are cross-reactive to other metals. So it is helping you even though we haven't proven a systemic allergy to it.
Yeah, it started helping almost immediately after you told me about it. Like the not eating off of metal stuff and not eating like nuts.
So I wonder if you developed a nickel allergy somewhere along the lines. You might want to consider retesting because if it's helping, I wonder why the test didn't pick it up. But it could be just a general allergy and not a type 4 systemic allergy. I don't know, but I'm glad it's helping. So you did implement that and it did help.
Yeah, I'm going to keep doing it until I don't feel no pain. It did stop a lot of my pain.
Can you point to specifics when you started that diet?
I stopped having to go to the emergency room. Like every few months, I would have almost like an attack and it would hurt so bad. I just couldn't do anything. I would break down and cry and there was nothing I could do.
Where was the pain?
It radiated from my lower back. It just radiated out. I did have a lot of joint aches, like my knees and my elbows.
And now, a word from our sponsor. Attention metalheads, are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. ELISA, a valuable diagnostic tool in medicine.
So you talked to a bunch of doctors about removing your hardware. Nobody would give you the time of day. So I'm going to introduce you to my doctor down here, which is Dr. Gregory Smith at Texas Health in Fort Worth. We tried to get you on with him a couple of years ago, and we had some insurance issues, some issues getting appointments and having appointments canceled and moved. But ultimately, you finally prevailed and you were able to speak to them. I think I had to intervene a few times to get you on the docket. And finally, actually, I think it's a funny story, so we'll tell it. This is my surgeon as well, who removed a lot of my hardware and was instrumental in my well-being. He removed my 10 pieces of my orthopedic lumbar hardware right when I got my first diagnosis and my metal allergy test back, and 60% of the pain in my legs went away. He was the doctor that believed me, and I got lucky because he was my first stop and he believed me immediately and got me into surgery within weeks. So he was my hero there. He also removed my cervical fusion plate. He also fused my SI joints. So he's done a lot of surgeries with me. This guy's my hero. We're going to throw a picture up here.
He's my hero too.
Yeah. And how it worked out that Dewayne was finally able to be seen and get surgery scheduled is that I had an appointment right before Dewayne's appointment on the same day. And I was in the office and we got Dr. Smith's team to agree to let me into Dewayne's appointment. And after my appointment, we did a FaceTime with Dewayne and a virtual visit with Dr. Smith. And why don't you tell what happened in that visit, Dewayne?
I was just amazed at how nice and how believing he was.
He's the king of bedside manner, isn't he? It's just like, there's no gaslighting with him.
Yeah, it didn't take us but a couple of minutes, and he was like, yeah, I'll take it out. I'll take out the neck hardware too. And I was like, what?
Yeah, the 20 doctors who said not only no, but they're not taking out anything. They're not touching your lumbar or your neck. And I'll take it all out at one surgery.
Yeah, that really blew my mind. I was so happy after that. I could not believe it.
Yeah, and your birthday was coming up. So they were scheduling it the week of your birthday. Well, I literally watched Dewayne's jaw fall. He's like, really? Total look of disbelief.
It had been a long time. I never talked to a doctor that would listen like this.
He didn't even really listen. He was like, yeah, it's a problem. Let's get it out. It was a 3-minute conversation.
Yeah.
He absolutely believes in the metal allergy.
And he absolutely knew what he was doing too.
So they scheduled surgery for the week of your birthday. That was only a few weeks out. You flew down to Dallas, Fort Worth, and you stayed down here. I came with you to surgery, and it was supposed to be a 2-hour surgery, and it turned into 6 hours. It was your first trip on an airplane ever. Let's talk about all that.
My family had a total change of heart because they realized that, I guess, that I wasn't full of it all these years.
They didn't quite believe you when you came down.
Some of them did, some of them didn't. Even finding a doctor that was willing to take it out was a big jump from me getting told that there was no way I could be allergic to this stuff. The airplane ride, I thought that was awesome. I liked flying. One time we hit a little bit of turbulence. It was just a tiny bit, though. The plane ride was excellent. The experience at the hospital was even better than some of the hospitals around here.
Now, I forget, did you have a pre-op visit? Did you meet him before surgery or only the day of surgery?
Just the day of surgery. We did everything that day. They had it scheduled for the day of my birthday, and they ended up moving it to the prior day.
Dewayne and I have become pretty close. So I was at the hospital for the pre-admission, and I stayed through the surgery. And Dr. Smith came out and said, man, that was a beast. Tell everybody what he told you when you finally woke up. Were you in a lot of pain? Could you tell any difference yet? Were you nervous going into surgery? What risks did he tell you about? How long did he tell you it was going to take?
He told me it would take about 2 hours for the surgery. And the neck surgery went just like he planned. But the back surgery, it took 4 hours just by itself.
He had some complications when he went to remove the hardware.
Every head of the screws broke off. all the heads. And then when he was removing the screw itself, every one of those broke in half. He said it was the hardest hardware removal he'd ever done in his life.
It had been in there like 20 years, the hardware.
21 years.
A long time.
Yeah. And so my body was definitely attacking it. And he said that's what made it so brittle.
The surgical report said that it came out in pieces and it came out with fragments.
It also had like little tiny splinters all over him.
How much pain were you in when you woke up?
It was all dampened big time. It was just one little spot that I was having trouble with.
I remember that you woke up in just massive pain. It took us a solid 12 hours to get your pain under control, correct? There was one specific spot in your lower back that was causing a huge amount of pain. Now, he had done a lot of work moving things around to get the screws out, different angles, like a lot of trauma to the muscles and things like that. But you were on a lot of other pain meds when you came in because of just your day-to-day. And then we had to get approval for some stronger pain meds. And it took us a good probably 12 hours to get your pain under control. But then you started to notice you were having really specific pain down in your low back. And that continued to bother you for a while. You did ultimately find a cause for that, but we're not to that point in the story yet. So let's leave that to the side for right now so we can go in order. What was the first difference you started to notice and how far out from surgery was that?
The stinging in my feet was starting to disappear.
In the hospital or immediately?
But yeah, I remember I did not notice it in the hospital. It had to be almost immediately.
I know that when you came, you were wearing a knee brace. You've only had to wear the knee brace once since surgery. And that was something you wore daily prior to surgery, correct?
Yes, I wore it daily because my knee almost nonstop hurt. I had surgery on it 3 different times. I think it just never completely healed. And as soon as I had the surgery, the pain went out of my knee and I barely feel it sometimes.
Great.
It's nothing near like it used to be.
And then I was checking on you repeatedly after the surgery. I think you had a lot of mental clarity, some brain fog that cleared up pretty quick too also, right?
Yes, I could think much more clearly. I don't forget where I'm at in a sentence near as much as I used to.
From memory, you had a lot less pain going forward, but there was still that one spot in the bottom of your back that was extremely painful. You said it would wake you up at night. It was at the bottom of your incision from the removal surgery. Tell us about that pain and then how you ultimately found out what was causing that pain.
I mentioned that to the surgeon, and he said that would go away with time. I just let it go and was hoping it would go away with time. But I felt it up till a month later.
And you actually thought it was infected. I'm going to put that picture up. It looks like a little area at the incision that wasn't healing, and you thought it was infected. So tell us what you found out.
It was seeping.
Like a month after surgery, it was seeping. So this is not normal.
Yes. So I was like, that's what's causing this thing to feel like the knife's in my back. I was like, this ain't going away. I got an appointment with my family doctor, and he just gave me some antibiotics and just kind of looked at it. Didn't do much.
And said, it's fine. It'll heal. And some of those, to be graphic, kind of down by the butt crack. And sometimes they don't heal super fast. So that's probably what he was thinking, right?
He was thinking it was my pants rubbing against it. But then I had an appointment with my neurologist for the dystonia the next day. He looked at it. He said, they don't look that good. So he got one of those things you look at people's ears with. I don't know what they're called. But
I think it's an otoscope.
He used one of those to look at it. And he said, I see something metallic in there. And I was like, metallic? He said, it could be a splinter left from the surgery somehow. Mm-hmm. And I was like, is there any way you can get it out? He said, I can try. And he ended up getting it out. He wasn't sure if he got it out, but he got it out. And then within a week after that, it was still putting stuff out of it, but it was healing. Finally started healing after all that time.
Did you ever see the metal splinter?
No, it was so small. I think he lost it as soon as he got it out.
Oh, wow. Okay. But here's the point. You have this teeny metal splinter and you have this area that's so inflamed, it won't heal. And you take it out and it starts healing. So again, back to the metal allergy and the inflammation from the metal, right?
Yeah, you could just imagine what all that metal was doing in there.
Amazing. So now I haven't talked to you or even seen you a lot since. So now that we've got that healing and we're Months out of surgery. How far out from surgery are you right now?
2 months to the day.
2 months to the day. So we are 8 weeks post-op. Tell me what's changed. I want to know all of it.
I haven't had to take as much pain medicine, not near as much.
If your pain at the time of surgery was a 10, what is it now on a daily basis?
I'm not noticing it near as much. The only time I notice it is in the mornings when I wake up.
So were you functioning at a pain level 1 or 2 throughout the day? Is it that low?
After about noon, yes.
Wow. Okay. That's different from functioning with a 10 all day.
Yes, that's way different. I can definitely feel that I'm happier. I'm actually able to go out and do stuff, at least in the evenings. The mornings are still a little hard, but things have dramatically changed.
Does your family believe you now? Your family and friends, how have they changed?
The ones that talk to me, I think they believe, but there's still people out there that I haven't been able to talk to. I think that they are still tied up with either thinking that I was crazy or that I was on drugs or something like that because I lost so much weight. I've seen people at funerals and stuff and they're like, "Are you okay?" And it makes you feel kind of weird and you don't know what to say, especially when you don't know what's going on.
Yeah. Your dad, I know, was super skeptical. What does your dad think now?
He doesn't talk much. He doesn't share much with me. It's hard to know. I think he believes, but it's hard to know.
Well, it's got to be hard to miss you getting better.
I've heard him on the phone say stuff to people. So, yeah, I think he does believe it.
Yeah. It's hard for people to admit when they might have been wrong. So maybe he'll be a little slower to come around.
I definitely believe that.
Especially that generation.
Yeah.
They don't show a lot of emotion sometimes, that generation. Have you gained weight?
Before surgery, I wasn't able to get over 147. I'm up at 155, 156 right now.
Wow. And that is just 8 weeks post-op. And we're not
Yeah.
having the stomach pain or the mad pain anymore.
I don't have no stomach pain no more.
How's
I
the
mean,
dystonia?
I thought it was almost gone there at one point, but because I didn't get my Botox when I went in, I just got him to take a splinter out. So a month later, I did have to call him and tell him, "Hey, I need a little bit," but I got like a third as much as I normally do.
And that's significant because with the way that hardware came out of your body, and I'm putting your hardware up here now, that's how much hardware came out of your body, people. That's a lot of hardware, 2 full containers of hardware. The post-op report that we put up says that there were metal splinters and the pathology came back and showed metal fragments. So it's very possible you still had metal fragments in your body.
Yes, they're that small. I know he cleaned it really good, but
Yeah, he said he rinsed it out as good as he could, but he couldn't guarantee there wasn't stuff still in
yeah, if that one was still in there, there could be a couple of others that may take a while to break down.
Yeah, but now you have a life that you can actually function in. You're not on the verge of not wanting to be on the planet anymore.
Oh, definitely.
How does it feel to finally be believed by your body?
Prayers have come through. I've been praying for this for probably 10 years. It feels like God actually stepped in. I swear that Dr. Smith is my angel.
I'm showing a picture of you and Dr. Smith. This is from before surgery. Dr. Smith's a great man. And before everybody gets so super excited, I think he's going to retire next year. We're hoping we can find somebody to replace him because he's one of a kind.
Yeah, I hope that he's taught his understudies what to do and what they can expect because there is really nobody else out there like him.
I know a few doctors that are like him, but he's special. I'd like to see if I can get him on the podcast as well. Too late to get him on this podcast episode, but I'd like to have him come on and talk about his experiences. We're going to have to wrap up here pretty soon, but when you were down here, we found something else that you didn't know anything about. You're now exploring another diagnosis. I noticed you were super hypermobile and perhaps looking at potentially an Ehlers-Danlos syndrome or an EDS diagnosis. Have you started to look into that at all or still a little too soon?
Actually, I've gotten hooked up with this place called Solus Health. They help people navigate through this stuff. I wish I'd found them 10 years ago, but she has found me a doctor in Charlottesville to test me for the Ehlers-Danlos, and she's got 2 other things going on for me.
How much hypermobility do you actually have?
I can move my arms like 2 different ways, like with my hand flat. My arm really comes in farther than it should. My right arm used to do the same thing until I crushed it. My knees will fold back farther than they should. And I can stick my shoulder blades out really far, like a cat. That's what it reminds me of whenever I looked at myself in the mirror. I'm like, wow, it's like a cat back there. Then my hands are double jointed. I marked off that paper you sent me. I marked off 8 out of 9 of those things.
I'm still working on my own potential ADS diagnosis, but I think it's the Baton score. That's the score sheet that they use for screening criteria for Ehlers-Danlos. And you said you marked off how many?
8 out of 9.
So we are seeing this increased predisposition for metal hypersensitivity in EDS patients. You think doctors need to start screening for hypermobility before implanting hardware?
I think that would be a good idea.
They should start screening for not only hypermobility, but metal allergy before they implant hardware.
Yeah. Or they should at least say, I'm going to take this out when we're done so it won't affect your Ehlers-Danlos.
Or if we can't get this out, you might look at this diet if you start having trouble down the road. And I want to go back because we didn't bring this up. It's been covered in prior episodes, but metal hypersensitivity is often a type 4 delayed hypersensitivity reaction, which is why Dewayne Armstrong experienced no symptoms for a year, 10 months, 6 months after these respective surgeries, because it takes that long for the antigens and T cells to mount an immune response, correct?
Yeah, exactly. And I was going to say something else too. I've still got a lot of metal in me that I know I'm allergic to.
Yeah.
I'm hoping that this got it down below the levels I need, but there's still maybe some leftover stuff because I've still got this metal in me. I've still got all the SI joint hardware. I still got 2 screws in my spine.
Cages where your disc space was. I know because I got the same thing.
I've got coils where my lungs, like,
oh, that's right. You have that and I don't.
So I still could have a little bit of toxicity to it, but
I wonder how much the syndrome you have that I can't pronounce. I wonder if that would be associated also to weak connective tissue.
It's hard to tell because that's something I haven't been to the doctor for since I was 21, and I found so much more stuff out about it. But that's one of the doctors at this place, Solus Health, hooked me up with. So I'm going to go talk to him. So I could ask him some questions about it.
Awesome.
It's called Osler-Weber-Rondo syndrome.
Okay.
What they usually write down is HHT. It's hereditary hardening of the arteries or something like that.
So we're going to have to wrap up here, but I want to cover some questions in closing. If you could speak to yourself 10 years ago, what would you say?
Don't ever work at Alcoa, because if I wouldn't have went to work there, I may not have been experiencing this.
What would you say about keeping hope alive?
I'd say find God earlier. I do think that it was spiritual that he helped me with this. I was at such a down spot at one point where I could not think. I couldn't do anything mentally on my own. And so I think that he showed me this metal allergy when I was trying to look it up, because there's no way I could have figured it out on my own.
And you probably couldn't imagine that you could ever have hope to live a life like you're living today, even though there's still some pain. Did you ever think you'd be here?
I was at the point where I did not know if I was going to get help. Yes. There was a point where I did not think I was going to ever get better.
What would you tell somebody who suspects that they're allergic to their hardware, but they're afraid?
They need to get the test done in Chicago, orthopedic analysis. They need to do that.
But as we know, that's only part of the battle. Then it's finding the doctors. Then it's keeping hope alive. Then it's networking and really not giving up.
Yeah, I hope that more doctors start opening up to this. Really, because Dr. Smith even said that even if a surgeon puts it in you, they might not have the confidence to take it out. So they're not a great surgeon.
And then we go back to what Dr. Smith said. Here's a 2-hour surgery, and he's probably allotted for that, and he's going to get paid for a 2-hour surgery. I'm not sure they get paid for a 6-hour surgery. Like when they get in and have complications, I've spoke to this with another provider. This is why a lot of doctors are hesitant to take out another surgeon's hardware or to take out hardware at all, because you get into the OR and you think you're going to be there for 2 hours and you've got a tight surgery schedule, and 6 hours later, you're still pulling this stuff out fragment by fragment.
He sent me my estimate, and what they paid was almost double that. So I think he got paid for it.
Good. But you can see why a lot of doctors are hesitant.
Yeah.
You don't know what you're going to get when you get in there. You're opening a can of worms, taking this stuff out.
Especially when another surgeon puts it in.
For a long time, we didn't know what your hardware was. I don't think we ever even knew what your hardware was, because your medical records were lost.
Yeah.
Destroyed. Something.
They weren't lost. They were destroyed on purpose. And I don't know if there was a reason behind that or what, because I was begging him to take this stuff out for as long as I knew him.
And there was some weird hardware in there too, right? Some like non-standard weird stuff. Is that what I remember?
I know it wasn't like what they normally put in. No.
Didn't you tell me you thought that they made some of it where you were getting surgery?
That's what he told me. He said, we had to get it made to fit you, because not everybody's the same.
What do you think needs to change in medicine?
I think they need to listen to the patient more. And if they do listen to them, then start knocking things out from what the patient says and not just go in to think what they're thinking. You get what I'm saying?
Yeah, don't adhere to completely what you're taught in medical school. Think outside the box.
Yeah, listen to the patient a little bit more. If the patient's telling you this, then they're feeling this. They should knock that out before they start thinking what they're going to do. Do you understand what I'm saying?
I do. What keeps you motivated to share your story?
The fact that so much has changed afterwards, that this could help a lot of people. I think that there's a lot of people out there living with stuff, because I had all the symptoms for other things and I never had those things.
What does real healing mean to you right now?
Pretty much mentally. It's going to take a long time to get over how people treated me.
Yeah.
That's what comes to my mind anyway.
Yeah, you find out who your friends are.
Even your friends, they might be your friends, but when they start questioning you, then it really makes things so much worse.
Dewayne, you cannot come on the Heavily Metal podcast without sharing your favorite heavy metal band and your favorite heavy metal song.
Since I've become a Christian, I have not listened to it quite as much, but before all this...
there are Christian hard rock bands. Stryper, hello?
Yeah, before all this, it was Poison, Motley Crue, and AC/DC.
Okay. If you got to pick one, who are you going with?
Poison.
Poison. Favorite song?
Look what the cat dragged in.
That could work, right? That could work for this podcast. Aren't we all drug in at some point? Like that cat?
Yeah.
I'll throw it up here. I know Brett Michaels from back in the day. I'll give everybody a little treat. I'll throw that picture with Brett up here. And yeah, super nice guy.
Wow.
You ever met him?
No, I've been to 2 or 3 of his concerts.
All right, Brett, if you're seeing this podcast, Dewayne's your fan. Is there anything that we have not covered that you want to cover?
I'm sure I'll think of something after we get done.
Of course. Always do. The good news is we can always have you back for an update later. I'm going to go ahead and close out. And I just want to thank you for being my friend. Thank you for coming on. Thank you for being willing to share your story. It's been a pleasure to watch your journey a little closer than I've been able to watch some others.
Thank you for helping me out through all this. If it wasn't for you, I don't know if I'd be as far as I am today. Appreciate that so much.
I'm glad you're here. And I will close off by reminding people that we do have a petition on heavilymetal.com to ask providers and facilities to pre-screen patients for metal hypersensitivity.
I have noticed that they are doing that for like dental stuff. So if they do that for dental, then why don't they do that for the rest of everything else?
It would make sense, wouldn't it?
So, yeah.
I think a lot of it's been answered before, that they don't really have answers for what they would do if the metal allergy tests come back. We don't have a lot of good metal alternatives, right? So somebody needs metal and they're allergic to it. Do we save their life and put a stent in? Do we give them less pain day to day and fuse their spine? They don't conceive that they could be causing more pain if a metal allergy develops and they don't screen ahead of time. So I think they're just afraid to ask the question because they don't know what to do with the answer. They think it's rare. They don't realize it's not rare. It's underreported and nobody is trained on what symptoms to look for. So the more people we have on the podcast, the more we start talking about it, the more we start sharing, then the more it gets out there.
Hopefully things change soon.
Right. So go sign that petition, share that petition, talk to your doctors, share these stories, and want to thank Dewayne, thank all of you for being part of the movement to tell the medical establishment that we're not going to take it anymore.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware. and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.